If you have WhatsApp, if you can WhatsApp me, please.
Yes, yes.
Okay. Test. Okay. Shall we start? Do you want us to start? Yeah? Let me just remove the numbing cream. Yes. These are beautiful. I need gauze with alcohol. Just a whole bunch of gauze with alcohol. So this is mixed ready. This is ready. I just need a whole lot of alcohol here. This one is for first. No. I just put them the way I'm going to work. So this is the fillers. This is the meso.
Okay.
And I need to fix the headbed of the patient. So go down. Can you go back as much as you can? Yes. Relax. And you need to cover your hair. And she needs to put also this one. Paulina? Make sure all patients put the hair cap and this one covered from the front. So she has to put it now as well, please. Can you help her by the time I prepare? Okay. Yes. They will see it here, right? Is it going same time as me? I feel like the video is yeah. No, not like this. Not like this. Like this. Yes, like this. Thank you. You comfortable?
Yeah.
Okay. Okay. First, we're gonna make you sit up, explain everything, and then relax. Thick skin. White pen. Oh, no. Okay. So what I need here, in fact, is let's remove this because I'm gonna need a lot of gauze with alcohol. That's what I really need. If you can help me prepare, I'll be thankful. So it's gauze. So let's put this one here. Then square and spray alcohol because I use a lot while working. Thank you so much.
You're welcome.
And another one, more. Maybe just one, not two, because it's thick. So just one in each. Yeah, let's prepare. Okay. So what I'm gonna do is I'm gonna work on the cheeks and the jawline. So I'm gonna work first on the. No. Yeah, we start first. I will start using on the cheeks, lateral cheeks, and this part we're gonna use the M, and I'm gonna use the X large here. So M and X. This is for the upper face and chin,
Okay.
and then we're gonna do a full face mix of. This is the mix of Aqua L and DNA, and under eye booster, and then on top of it we're gonna do the Amber Stimulate, which I didn't prepare, which I will prepare now. Yeah, it's here. This is it. No, it's ready.
It's ready.
Yeah, this one, let's leave it like this because I did it in a nice way. So I will start with the under eye booster. Bueno. Can I start? Yeah? All right, guys. Doctors, we're going to start with our first case. You're welcome. If somebody wants to come on stage with me, you are more than welcome. if you'd like for 4 doctors to come on stage, would you like that? Or no? As you wish. If you want to have an up close, you know what? Yeah, please. Thank you. And these are the gloves if you want to wear gloves. So our first patient, her name is Annette. And Annette, we're going to do for her a holistic approach. So we're going to treat her face as a whole. So I would love this session also to be interactive. So I will ask you, what would you do to this patient? There she is. What would you do for her? How old are you?
42.
42. 42 years old, that has thick skin. She has aged with gravity pull. The jowls are droopy. You can see the jowls there. You have to take care of the jowls. You can see that she has this ligament that is prominent. We have to take care of that one. We have to reposition her fat so that she gets a much younger look. And once we reposition her fat, we're going to be taking care of her nasolabial fold. The nasolabial fold is the last thing that I inject because we treat the reason we have the nasolabial fold, which is the volume loss in the. Yeah. Okay. Tech people. Sure. No. So like this is how I'm giving the shadow. Yeah. We need light. Let me try this one. Wait. I have extra lights here. I thought about this. This one. Does this help on this? Okay. Yeah, because we have, doctors should see. Is it better? You wanted to come on stage? Yes. Where are you from? Denmark and Norway.
But we are nurses, not doctors.
Thank you for coming.
Yeah.
All right, guys, is this better? Yeah? Okay. So again, it's a holistic approach. We're going to start treating the patient from up to down. Let's start with the upper part of the face where she lost her volume and the temples. We're not going to inject today temples. I'm going to focus on this area because I want to show you without injecting the temples the result that you're going to get with injecting Infini fillers and meso combined. All right. So ideally, it's better if we inject the temples because she has lost volume here. It will help her, lift the lower face and the mid cheek and lateral cheek. Plus, she has lost the projection of her cheek. This is where we're going to focus as well. And we have this ligament that is prominent. This is where she lost the volume. We're going to inject that also. Her jawline has gone saggy. She has droopy jaws. So instead of making her jawline look wider, I'm going to do a technique where I'm going to help her have a longer jawline that will help her with this sagginess. And we finish off with the chin, lateral and medial protrusion. Now, with regards to the marionette, she's a patient that has a thick skin and sagginess to her face. I mean, we can do some fillers here to help her support this sagginess, but ideally, I would say that she's a candidate for threads. Okay, so you can go by threads with fillers with booster, but I will show you a technique with boosters where you can get rid a little bit of the marionette lines. You know that this is the most difficult part to treat. All right, shall we start? Any questions? Any suggestions? I will start? Okay, so we will start first. So for her, what I will start doing is I'm going to do eye booster under eyes. We're going to use a cannula. So this is a cannula, head entry point. So I just need you to give me the entry point. All righty. Yeah. So the point of entry is going to be, can you remove it? Don't do this in the clinic. So this is my entry point for the under eye booster. Everybody can see? Who cannot see? So can you stand here? Here? And who can you stand here as well? You need.
They want to see this area, and you have to do yes.
See, we're doing a good job, but the tax are not. Can you see? Anna, help. Who cannot see? Can you get closer? There are chairs here. Can you move closer? Anna, can you put this camera here? I need to close the. Anna, can you put this camera here? Can you? Can they see me on the on the big screen? Okay, so I will start with the under eyes. There are two. So what we have here is a patient that has lost her mid-face fat, and what you are seeing is the ligament that is pulling down. So I need to replenish that one. There are two ways of doing that. First, I'm going to do it by injecting the eye booster under eyes. She is a patient that you can see here. She has water retention. Do you have any issues with your period, any hormonal issues, thyroid issues? Do you smoke?
No.
Okay. She has, some fistones here. This is what we call fistones. These fistones we do not inject. So this is a no-go zone for me for injection. What I would love to inject is a deep injection here, where I'm going to replenish the fat that was gone, and I'm going to inject the patient also in the lateral cheeks and in the under eyes, but very light. Otherwise, she will have worsening of her under eye. So let's start with the eye booster. So this is the Infini eye booster. 1, 2, and 3. Deep breath. 1, 2, 3. You are still young, so what you have is a good amount of collagen. That's why you're gonna feel like that tick pull. Okay. So now I'm at the level of the bone, and this is where I'm going to be injecting my eye booster. I'll tell you something. When somebody asks me how much and what is the combination, you just put whatever you need. So what I used here is only a 0.4 ml of eye booster. So if you sit straight, you can see the difference with the under eye treatment. Okay? Now we're gonna go to the other side, and we're gonna do the same thing. You can stop me at any point, at any time, for any question. So. Sorry. We will do the other side using also the eye booster. Can you see? Can you see? Yeah. Can you remove the 1, 2, and 3? Again. This is my young lady. Thick skin. Let's do our puncture again. 1, 2, and 3. Okay. Pretend like you're not having any pain. Okay. 1, 2, and 3. And this is my second area that I'm injecting. Under eyes, at the level of the bone. Again, 4 ml, 0.4 ml of eye booster, and you can see the groove is gone. Okay, so this is my groove that I treated with Aqua Booster. Let's close this one, and let's move to the. This is for you. This is one. Okay, now let's move to the cheek fillers. Would you use? Okay, so for the eye booster is not a filler. The eye booster is a meso. Usually we use the eye booster meso. Yes. 22 gauge. 22 gauge under eye because it's more safe. So for the eye booster, it's a meso. I used it because we use the eye booster because it's a meso and the patient has some water retention, some swelling. If I use for her filler, it will get worse because the filler is going to attract water. It's going to make my result even worse. So it's not like she has a huge groove where she lost the fat. That's why I'm going to use the eye booster. The eye booster is a therapeutic treatment. The more you use it, the thicker the skin will get and the better results, like concealer effect that you get over time. So you tell the patients, we're going to do it today, but you will have to repeat it, let's say after 2 months. Okay, and in the meantime, you can tell the patients that to do other treatments, like for example, chemical peels, PRPs. But eye booster by itself is good. I need someone to stand there in case there's blood, just to wipe it. This is for you, other side. Alrighty, now I will start with the cheeks. My approach for the cheeks is going to be through two ways. I'm going to start by injecting the lateral cheek. Since the patient has good volume in the mid cheeks, I would love to take it laterally towards the hairline. This way I can provide her with a lift, focusing on the highest point of projection. You know how to get the highest point of projection? The way you get it is by relax your face. Let me move you. By drawing a line from the lateral canthus to the lateral commissure, and from the lateral nose to the trachea. So, sorry. Let me clean it. Because too much blood. So, this is the tragus. And this is the other line. This is my highest point of injection. Okay? This is where I want to have the most of the fillers done. Now let's start with the product I'm using for the cheeks is going to be the Infini M. Okay? M. And I'm going to be using, I prefer to use a cannula. See, I like cannulas and I like direct injection. Whenever I want to lift the tissue, I use direct injection because I can control how deep I go into the fat pad, I go under the muscle, and I lift everything all together. Whenever I want to do contouring, and as if she has the impression like she's done the makeup, then I go for the cannula. So in this case, again, we're going to use the 22 gauge cannula. No, because the patient has thick skin. She's aging with gravity pull. So you need something strong to hold everything together. Huh? We're going to use the XL for the jawline. Okay? So this is the medium. Can you hold it for me? And we are going to do the cheeks. Alrighty. Let's start with the cheeks. You okay? So again, this is my port of entry. I'm avoiding the arteries. I'm hitting the fat pads. And I'm going to be injecting the patient. Turn your face to the side. Now, it's very difficult for me to tell you how much you need, okay? Really, I don't like telling the patients or the doctors that we're going to use one drop. So, this is what I'm going to be injecting, my medium Infini. Retrograde technique. If I'm going to do for her also temporary fillers, we can use combination of both gunshot injection and cannula. So now you see she has the egg-shaped appearance and she has nice lifting and her nasolabial folds have improved drastically. All right, we are not done yet. We will go for a direct injection with the M as well. See here, I'm giving you the best case scenario where we're being very picky on how to inject, where to inject, and the technique. So this is your ligament. You go deep to the level of the bone and you start injecting. You good? 1, 2, and 3. Again. As I explained to you, these are safe zones to inject really deep. And there you go, the third one. And we're done. I'm going to wait for the blood to stop, and I will show you the results. Can you all see the result? Can you see the lifting? Yes. And okay? So the difference between the right side and the left side is that she doesn't have any grooving anymore. She doesn't have any hollowness under eyes. And we started treating her ligaments. And we replenished the fat wherever she needed those. Okay? Now we're going to move to, okay, another thing for you to take into consideration is the treatment of the melasma in the cheeks. So after you do this, you have to treat the melasma in the cheeks because it will help with the shadowing that you see here on top of the ligament. Now I'm gonna go and start working. Can you close these two? I'm here. I'm gonna go ahead and start using the XL for the jawline. We're gonna do XL for the jawline. We're gonna make her jawline longer, not more protruded, longer. And when I'm working on the chin, I might work with the cannula and a direct injection, both. Doctor, I'm gonna use here the XL. Leave it because I will use it later. This one, I will use more. Alrighty. I need, yeah. So face toward the side. As I said, she's aging with gravity pull. I have a good amount of fat here that we don't want to touch, otherwise it will get saggier. Doc. So this is the corner of my jawline. I need help. All right, 1, 2, and 3. And this is where I'm going to be.
Better or no?
This is better. Can you see? So this is where I'm injecting the jawline with my XL. That will give me support. It will give me lifting. It will give me definition. Where am I injecting? I'm injecting the areas that have lost the fat. Making her jawline longer. There you go. So barely any droopy jowls, so she needs a treatment from the lateral chin. She still needs more filler in the lateral jawline to give her a better lifting. As I said, she's a candidate also for threads. Combined with filler will give her the better results. What's nice about this product is that it's going to give me a lifting without giving me any media projection or volume. So she will not look squarer in this technique, okay? There you go. Can you sit up? Can you lift your head? And then you can see here the difference. She still has additional skin, which you can treat with threads. No more fillers for this patient, okay? The jawline has improved a little bit. See, what I'm doing today is I'm showing you cases that you're going to be seeing in the clinic, okay? Now we're going to be working on the lateral chin. Go back. And we're going to do direct injection for that using also the XL. Direct injection. This is a 27 gauge. 27 gauge. No, I have it. Yes. No, I have it. It's okay. Again. 1, 2, and 3. I replenish the areas that has lost the fat. And I'm giving some support to the marionettes. You okay? Pain? All righty. See, so when we combine the treatment of the lateral chin, lateral jawline, she has improvement in her jawline. This is XL. Yeah, this is XL. Can you open? Close. And we're gonna give a bolus also to have support the marionettes. And there you go. The marionette are the most difficult to treat in the face. You agree? Okay, let's change the needle head because we're going to do more of the chin. XL. No, direct injection. XL, this one. If there's blood, just remove it, please. Okay, so like we said, the chin is going to be a deep injection. In her case, I want to make the chin a little bit longer. a little bit more protruded. Keeping it perfectly. And there you go. Now, which area of the face, if I inject, is going to help me more with her results? Goes with alcohol. See, the jowls are still droopy because she has a lot of extra skin. What am I going to do with this extra skin? So like I said, I suggested, you used to gain weight, lose weight, gain weight, lose weight, lose weight. Yeah? So this is the yo-yo effect that has caused her to have sagginess to her skin. So it's either she goes for thread lifting, like I said, or if you want to put fillers, because this session is about fillers, you put fillers in the areas where the patient will get lifting, maximum lifting, without having wider looking face. So one area of injection would be the deep fat at the level of the bone. This is where I can add more fillers. So in that area, we can also use the XL or we can use the medium. We can use the medium direct injection. Medium direct injection. Yeah. 1, 2, and 3. There you go. And for more support, I would go also to inject the nasolabial folds. Good. Healthy patient that bleeds. Good. So I need more gauze, please. More gauze. Thank you. So what do you think of this result? We're still not done yet. We did with cannula the lateral cheek, and now I'm injecting a direct injection for the lateral cheek. It's going to be in the deep fat layer, and it will give me more lifting effect.
With cannula or with needle?
No, I'm just done. Yeah, thank you. Good. So we use combination of eye booster, medium filler, and XL filler so far. Okay? I would advise you also for this kind of patient to do fillers for the temples. Now, the trick that I use is after I do the fillers, I inject meso everywhere. I didn't work on this side because I want you to see the difference. Once we're done with this side, I will do the other side and show you. So for the meso injection, we use a combination of aqua booster with L meso with DNA. No, I have it here. Leave it. This one, leave it. So we use combination of aqua booster with L with DNA. Now I'm going to mix them. And also one more trick. After I do the fillers, when I use the meso, I can do 5 points, and then I do superficial everywhere. And she will have the perfect lift. Do you know how to get the 5 points? Yeah, I will show you. So I will show you first the result of the filler. Can you go up? The result of my filler. You see the difference between the two sides? Improvement of her nasolabial folds, of her marionette lines. We have one side of the face that's gone high, one side of the face that's still down. Now we're going to give her the effect that's going to make the result more long-lasting if you want. So I will give you now the 5 points. We used eye booster, M, XL. Now, eye booster with cannula, we treated her groove. Then M, we did with cannula to lift the lateral cheek, direct injection into the ligaments so that this groove goes away. Then we did the drawing for her jawline. Instead of protruding the jawline, we lifted it up. And we did some treatment for the marionette as well. Okay? Now we're going to do the 5 points. This is my first point. 1 centimeter or 2 centimeters below the lateral canthus. Then in front of the tragus, then in the jawline, then intermental area, and then lateral nasal. Okay? These are my 5 points. We're going to be using what kind of cannula or what kind of direct injection? We're going to be using the yellow head. Where is it? This one. The 32 gauge. 30 gauge. Sorry, 30 gauge. This one, but 30 gauge. So for the 30 gauge, we will do first is the direct injection. So this is my first point. Don't ask me how much I put. Really, this is a matter of how to say experience when you touch the skin, how thick it is, how much volume you have, how much fat you have. Alrighty, and now after I finish the 5 points, I'm gonna show you one technique of injection where actually you can give an insane lift for the patient. 1, 2, and 3. So I will have you sit up as well. These are the 5 points. Now you can see the result after the 5 points. Big difference. Remember, we're doing this without threads. We're doing this with fillers without giving the patient a wider face. Now we're gonna do the remaining. Yeah. I prepared 6 ml in total. 6 ml in total. 1 ml of aqua booster. I did with it meso L, meso DNA, aqua booster, meso L, meso DNA. 5 points, and now direct injection. So this is a technique I would like you to use, which is we go underneath the zygomatic bone right away, and we go superficial, and we inject everywhere to give the patient a natural lift. Jawline, same combination, aqua booster, DNA, and L. I know it's painful. And then nasolabial folds. And also you can use it under eyes. That's it. Now we still have one more thing that I would love to use. You don't have to use it, but I'm showing you the best case scenario where we use the amber only. The amber stimulate. You have the amber plus that comes in a syringe, and you have the amber stimulate that comes in a meso vial. So I'm going to finish off with the amber. Why? Because amber, like I told you, it's their joker. The amber and the eye booster is their joker. Patients, when you do for them amber, they leave the clinic super lifted. So I'm using a 1 ml. I withdrew. You always withdraw with 18 gauge. It makes your life easier. So withdraw the product with 18 gauge. Put it in the 1 ml needle syringe, the one that you use for the Botox, and use the small needle head, which is the 32 gauge. Okay, the smallest one that we can have, and we will inject the under eye everywhere. So this is the amber stimulate. Not only I do under eye, and really it doesn't cost you much in your clinic because you have plenty of products in there, and you can use it on so many patients. I usually, if I want to treat the patients without fillers only with meso, I tell them to do, I would say, 4 sessions in over 3 or 5 weeks. And we're done. You are an excellent patient. I need this one with alcohol. All righty. Good. So one side of the face is done. One side of the face is not done. Can I have the Fusidin ointment gel? It's right in front of there. Here. Fusidin. Yes. Can I have some gel here? More. I like to put more of everything. The remaining part is just, treating the melasma that the patient has. During the break, I will continue doing the rest of the face, okay? Just not to bore you out. We're not gonna let you go with the half face done, half face not done, don't worry. Okay? but I just wanted to show you the difference between left and right. Can you sit up? Okay. Thank you. Merci beaucoup. Now this is the trend. You do one side you don't do. So during the time you'll be having your lunch, I'll continue. Unless you really want to have a feel of the product, so I can have any of you come, 4 or 5 doctors that can do the injections. What do you want? Would you like to do that, or would you like me to do it during your lunch break? So you can watch me when I'm doing in the lunch. Anybody who wants to see closer, then come during the lunch break. Okay. Janet, merci beaucoup. Merci, we're done. And the lunch break, I will continue. Okay? Don't go anywhere. Okay, our next candidate is Carolyn, right? Yeah. I wanted to do lips, but most of the models are scared of the pain because the injection technique I do, which is the Russian technique, is very painful. So they need the local anesthesia. Yeah. Can you go back? You understand the English, right? No, no English. So can you translate? So can you go back and put this? Okay, we're going to cover the hair with a hair. Yeah, yeah. So for this patient, what are we going to use? XL for the jawline. And L. XL. Sorry. Also XL. And also XL. And this is my mixture. Perfecto. Aqua Amber DNA. And I finish off with Amber. So a couple of tricks that I would love to give you. Under eyes, go for eye booster. Okay, if you want to give the patient a really nice lift, whether it's with or without fillers, always do 2 techniques of injection. Do the 5 points injection, and after that, do the superficial injection. For the under eye, always do the eye booster, and then do the Amber stimulate with the very small needle, 32 gauge. Okay. I have seen great results that I wasn't able to see in the market with other products unless I do more than 1 session. Okay, a cannula, 3 cannulas, 1, 2, and 3. So can we put them on the XL? This is XL. This is XL, and this is XL. Okay, and then I'm going to do the large. Let me see. Oh, perfect. Relax. No smiling. Relax. So here the XL. We can do XL. Haha. Okay. Can you sit up? So the first patient that you saw was a patient that has a thick skin. So she was engaging with gravity pull. And like I said, this is very difficult to lift without giving an extra volume. And I will do combination treatment with threads. For Carolyn, right? For Carolyn, she doesn't have a thick skin, but rather she has a very thin skin that has gone saggy. Alrighty? So for her, doing deep injections with fillers combined with a superficial injection will give her a fantastic result. Okay? She doesn't need threads. Relax. I know you're very happy. Try not to smile. Okay. So I'm gonna start by doing her. See, can you bite? Okay, she has a strong masseter here. So even though I would love to lift the jawline with my fillers, I cannot put too much. And if I put too much, I have to put also Botox for the masseter so that it becomes slimmer. So we will treat this area where she lost the volume, which is in the lateral jawline. We will treat also the same here, the marionette, to give her support. In the under eye also she can benefit. So probably we're going to use also the eye booster that we used here. If you can replace the cannula, 22 gauge cannula. Here she lost volume in the temples. and she lost volume in the lateral cheeks. This is your first time?
Yes.
Okay. Would you like me to do the temples? Okay. All right, so we will do the temples. So for the temples, the markings are as such. You mark the temporal bone, orbital rim, 1 centimeter up, centimeter down. This is what I'm going to inject. Again, orbital rim. This is my bone. You touch it, you feel it. Orbital rim, 1 centimeter up, 1 centimeter down. This is what I'm going to do, my direct injection. If I want to do the cannula, so I will go lateral with the cannula. I don't go with the artery. We can. I mean, you can. But most of the time, I notice that when we go lateral in the temples, what happens is some areas are filled and some areas are not filled. So you will have like a hollowness effect. The nice thing about the temples is that when you fill them, usually patients, when they take photos, they tell you that I feel like my eyebrow is cut. So once you do the temples, it lifts your eyebrows and it makes it, more linear rather than groovy. And once we do the injection with the direct injection, we always underdo the temples because they will get bigger over time. So we just inject this point and you massage the entire area. Starting from a holistic approach, we are going to start injecting the patient in the temples. Then I'm going to fill up her lateral cheeks. Then I'm gonna do the treatment for the under eye with the eye booster. Then I will do the same thing I did with the other patient, which is lateral or direct injection with XL or L, depending on how thick the skin is. In her case, she doesn't have a thick skin. For Annette, we use the XL and the XL for the lateral cheek to lift. In her case, we can use the large instead of the X large to lift. But in the volume loss for the mid cheeks, we can use the medium. For the marionette, I would go for the large one also because she has a very thin skin. I need some more support. And also for the jawline, I would use X large or large. All right? And then after the filler, always, 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 really trust me, finish off with your mixture, whatever the mixture is, whatever you decide. 5 points, then direct injection everywhere, especially with the amber under eyes. So, relax. So for the direct injection for the temples, I will use the medium, or I would go for the S. Let me use the S. Yeah, because the mid. Yes. No need to change it. It's from there. No, from there. S. Okay. S direct injection. Alrighty. So let's wipe everything again. I like to repeat things so that everybody remembers. We will start with the upper part. We always treat the face holistically. Upper part towards the lower part. She has lost the lateral fat, so this is going to be replenished. She has a lot of veins here. So once we palpate, we can tell where the arteries are. This is my temporal bone. She has a risk of bruising because she has a lot of veins. If you get bruising, even if you hit an artery in that area, what would you do? Just press hard with ice. That's it. There's a high blood flow for the arteries, okay? So within 2 minutes, it will close. You're not inside. Definitely you didn't, if you're injecting in the right place, definitely you didn't inject filler in the artery. You just probably passed through the artery. So even if you get a hematoma this big, don't worry, it's fine. Just press with ice. Compression of the... That's why you have to put ice right away and make sure that you follow up your patients, make sure that there's no compression, give her treatments, like medication to reduce the swelling, and mostly focus on ice. One time I was doing thread lifting for a patient and I was doing a technique for the ponytail lift. So we go from the cheek to the scalp and the patient had a tennis ball here. Just in 2 minutes, I pressed, fine. It's scary. It's not fun to see, but it goes away. So with that said, hopefully you will not get any bruising here. So 1 centimeter up, 1 centimeter down. This is my point. Again, I palpate. And I make sure that there's no pulse there. Okay, thank you. Let me check. So this is the S. Yeah. Direct injection. So what I usually tell the patient is that we're going to count to 10 together. You don't count, I count, okay? Don't be scared. Don't go away from me. You cannot run away from me, okay? So when I inject you, don't do like this and don't run. Sorry. Sorry. Okay? So once I inject you, you're gonna hear a sound of crick, crick, crick. Don't be scared. This is just the product going in because this is empty, my love, and we have to fill it up. So empty, you're gonna hit crick, crick, crick. We're gonna count to 10, and then we count 1, 2, 3, and remove the needle. Now, deep breath. Deep breath. Yes. Relax, don't move. So I'm going to lift a little bit because it's going to help me give her a nicer result. Also for patients that have a good amount of collagen, these patients usually don't need the threads, they need like fillers and Botox. This is the S. I'll tell you something. I would have loved to use for her the M, but because she has a thin skin, so most likely the M is gonna show, okay? Plus, when I'm using the M, it's difficult to push it. I wouldn't use a product like that in the temples, otherwise I will have a bruise, okay? What is M now? Okay. 1, 2, 1 second. We have superficial veins. We don't want to hit those. 1, 2, and 3, and there you are. So we withdraw a little bit. Some doctors wait for 10 seconds, I don't. So let's start injecting. 1. It's not going in. I need to change the needle. We're gonna use the 27 gauge. Don't worry. No. I'm the pilot. You're just in the back seat of the plane. Relax and sleep. We're gonna use a thicker needle, which is 27 gauge. No, here, 27. This. You're gonna feel pressure and not pain. This is 27, yeah. Again, Mamacita, let's start. 1, 2, and 3. Deep breath. No. Do not bite. I withdraw. There's no blood. Close your eyes. We're going to count to 10. 1, 2, 3. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now I'm going to count to 3. 1, 2, and 3. And you did it great. Perfecto. Very nice. So it shows like she's done nothing, but at the same time, she has the lifting for her eyebrows and the groove is gone. You like it? I used half a syringe. Okay? So we replenished the fat here in this area. Now we're gonna do the lateral cheeks. Back to sleep. Anytime you want me to ask the patient to sit up, just let me know. We're gonna use the XL again. We have L here also, right? I'm gonna use the XL for cannula, and I'm gonna use the L for direct injection. So 1, 2, and 3. Again, same technique, going into the hairline. 1, 2, and 3. So sometimes dissection helps by itself without injecting anything, right? Mm-hmm. 1, 2, and 3. This is the XL. You're fine? Good. So we're treating the face lateral to medial. Huh? No, this is XL. You can use the L. You can use the L. You can use the L for because she has a thin skin. But I like in my demonstrations to show the extravagant results. So I use thicker product. I would recommend to use the L if you don't feel comfortable using a thick product, because after that you have to massage a lot so that it doesn't accumulate. There you go. Perfecto. Can you sit up? You see now how she has a nice contouring for her cheeks, as if she has makeup on. Now, my cheek is nice, but it doesn't have the projection, so I need the direct injection. I will do the large for the direct injection.
With needle?
Yes. This is the 27 gauge? No,
no.
you need 27 gauge. This is a 27 gauge.
I suppose it's the same.
No, it's not the same. So, can I have gauze with alcohol, please? Alcohol. 1, 2, and 3 at my highest point of projection. Again, white pen, please. White pen, marker, white pen. Highest point of injection. There you go. 1, 2, and there are certain tricks. Like you take the skin and then you inject at the level of the bone right in front of the crease. Pain? Good. And I'm done. L. L is quite thick, but it's really good. I use 0.2. It's a thick product, I'm telling you. And sometimes it's difficult to push it, but it's worth it. I have to tell you everything, right? So why would I use it and I wouldn't use something else? In patients that I really want to give a strong lift, strong jawline, men that want to have a strong jawline, strong definition, I would use this product. It's difficult to push, but it's good. Good result. And there you go, my love. What do you think of this lifting with 0.2 ml only of the L? 0.2 ml only. Okay? So now we know that the L can be used for areas that have, volume loss. At the same time, I want to give them a strong pull. For the jawline, what are we going to use? Again, like the patient before, cannula XL. Okay? Cannula XL. This is, what is this? This is cannula. And yum, yum, yum. Goes with alcohol. Okay, turn your face to the side. So she has a strong jawline, right? So we don't want to put too much in the jawline here, otherwise she will have bulging. 1, 2, and 3. That's it. Sorry. And let's go. Again. I would advise that this patient does Botox afterwards, okay? And there you go. Replenishing the fat that was gone without causing her to have volume, right? Let me see. Beautiful. Then we're gonna do also this technique, point of entry point. I need the entry point, please, for the lateral chin, because she has so much volume loss here. If I go with a direct injection, I cannot hit the whole thing. Same point of entry. We're gonna do 1, 2, 3. Sorry. Turn your face to the side. First, I dissect. It makes my life so much easier. Then I inject. Oh, doing great. It's painful. It's painful. But we have brave candidates here. 1, 2, and 3. There you go. Now, since I replenished the fat without giving the patient a fake look, she still looks natural. What am I going to do with this and this? This is where the role of the meso comes into place. Okay? Do we need to do for this patient the 5 points approach? No, because it will not give her a big difference in the lifting. What she will benefit from is injections everywhere. Does she need now under eye treatment? Possibly. She can benefit from the under eye booster. We can add that also now. We can go and fill up only this triangle that is empty. So let's do the eye booster with cannula. I have one that is open. No. Eye booster. No, new cannula. Any questions so far? I'm gonna do now eye booster, and then I'm gonna booster everywhere. The combination I'm using for her in this case is going to be aqua, amber, DNA. Okay? Aqua, amber, and DNA because I want to give her some nice lift. DNA because I want to thicken her skin, and aqua booster because she has lost her skin elasticity. Now the eye booster. 1, 2. You don't have to do all of this. You can divide these into sessions. Where is my entry point? There you go. Okay. Deep. 1, 2, 3. Deep breath. Merci. Happy? Happy. So at the level of the bone, and she's done. Now, let's do the mixture. This is my mixture. Amber, DNA, and what else? Aqua booster. Aqua booster. 32 gauge. What is the 32 gauge? This one. This one. So you can put it on that one. This one also. Yellow head is there. Yellow. Okay. Yeah. 1, 2, and 3. So, how do I do this? I just pull the skin and then I inject in front of the crease. In front of the crease. I don't care if we inject 6, 9, 12 ml, as long as the patient gets the results. Same thing here. In front of the crease. See how the nasolabial fold has gone better? Now we can do some treatment for the nasolabial folds, but how do we do that? By injecting the mid-cheek. So after we're done, we're gonna do some injection here in the mid-cheek to lift the nasolabial folds. I will use the M direct. To recap, we used small for the temples. To give a projection, we used the L in the lateral cheek. I used the XL fanning technique with the cannula. We can use the L, but I wanted to show you a better result. And for the mid cheek, I used the M. And we finished off with the mixture. 1, 2, and 3. No, 27 gauge. No, this is too small. Fillers is always 27 gauge. Here I'm injecting the deep fat. You're okay? You can do it with direct injection, and we can do it with cannula. There you go. Now, If you want to inject the nasal before, smile, smile. Ask the patient to smile. Go very deep to the level of the bone. 1, 2, and 3. Oh, sorry. And you're done. Now we finish off with a tiny amount of mixture everywhere, my love. One, two, three. Cheeks, jawline, chin, even neck. Let me see. Can I have wipe with alcohol, please? Not bad at all. So she has to do treatments in the future for the skin, like radiofrequency, right? Some collagen boosters, because she has lost elastin and collagen, and this is exactly what she needs. Or also threads, the small threads, like the screw ones, because they will make the skin thicker. Can I have fusidin ointment gel, please? Let me see. She still needs some fillers here. 1, 2, and 3. More XL. Cannula.
Cannula?
Yes, cannula. This is XL cannula. This is, no, this is eye boost. This is XL cannula. Can I have the entry point, please? No, this is not the entry point.
When you do that all-in-one treatment, which advantage you have in compared to when you would do it by step, for example, meditherapy, separators to the fillers? Because like I think that, okay, today maybe it's good, but next day it will be very swollen. So
No, it will not be very swollen. No, at all. At all. This is the maximum swelling, what you are seeing here. It will go down. On the contrary, it will go down, and the fillers, it will take its shape, and it will relax, and it will be more soft. So this is the maximum swelling when you see it. What's the difference? If the patient can afford, go ahead. So it's nice to do transformations, but you don't have to do all of this all together in the same session. You don't have to, of course. No. This is, I have to make it clear. You don't have to do this in the same approach. I'm just letting you know that over time, if you see your patients 4, 5, 6 times, okay, you can make a plan with Infini. So for example, let's say today she comes to me. It's very important that I start with the temples. If she doesn't want to do the temples, fine. I can do the cheeks. If she can do temples with cheeks, this is the best case scenario because this will help me lift this area. Okay. Then later on, if she wants to do the jawline, we can do the XL for the jawline. If she can afford doing fillers in the same session, then I would do temples, cheeks, and jawline. If she cannot, then I can do temples and cheeks, and then I can do with Infini some meso to give her an instant lift by the time the fillers takes effect. Okay. If she can do the under eye also, I mean, first time you can do the temples and cheeks, then you can do the under eyes, then you can do multiple sessions of meso. Or if the patient doesn't want to do any of those, she can just do a combination of meso, and she will have a very, very good result. I'm just showing you after 3 to 4 months after 3 to 4 treatments how she will look. Best case scenario. We're gonna add some XL here, and we're gonna add some XL to the lateral cheek. The reason I didn't put this before because I was trying to have a lift using the meso by itself. She needs more fillers. Okay, Habibti. Sorry. 1, 2, 3. 1, 2, 3. Bravo. Yes, I'm done. 2 minutes. There you go. And one more. Injection. Just to treat the lateral cheeks, and we're done. Everyone is a bleeder here. Okay, 1, 2, and 3. Bravo. Excellent. معلش, it's okay. This is for us to give you the perfect contour. And done. Press, ice, bruising will go. Fusidin ointment gel. I will show you now the final results. So just to recap, the holistic approach, we can start with the temples by themselves, temples, cheeks, under eyes alone, temples, cheeks, jawline. First session, it can be only fillers. And then you ask the patient to come back and you maintain for them the treatment with Infini booster. Sometimes when you do the booster, they don't even need the fillers. This is what I was trying to do now. I tried to do the booster to see if she needs filler. It didn't work because her skin is too thin. It will take time. Yeah, it takes time. But sometimes it gives a lifting effect.
For how long? Because after most the comes I take them one day.
No, you cannot do when you some patients they ask for treatments with booster. They don't like to put fillers in their faces. These are the patients that I only do boosters for. But otherwise, no, of course not. We cannot do magic only with boosters. They have to do fillers at some point. Okay. And this is my Fusidin ointment gel. Let me see. Fusidin ointment gel. Ointment, yeah. So sit up and you want to show it? Can you sit up, my love? What do you think, guys? It's good? Beautiful, huh? So one side that is lifted, one side that is down. Lifted, down. Marionette, nasolabial folds, very difficult to treat. Done. Merci beaucoup. Thank you. Done. Now we can eat. Any questions? Halas? Thank you. I'll see you after the break. Thank you. I have to continue. I have the faces. I will continue now. I did only half of your face.